I'm Kamilah Stevenson, and thank you for tuning in to another episode of Healthgoat. Today, I want to talk about what doctors don't tell you but should. And I want to address the approach that many physicians take and just conventional medicine doctors or our system of care, of healthcare, and the structures and the systems that's in place for them to help us to prevent chronic disease and create a blueprint for longevity, or either reverse chronic disease. And quite frankly, a lot of the approach that we're seeing with conventional medication is pretty much a distraction from the real problem that lies at hand. And it is also a Band-Aid to get us to feel better about numbers usually. But it still creates havoc on the body, and doctors don't often give us the proper information to make an intelligent decision on our health. And I want to talk about that today. I also want to give my approach and opinion on the topic of a medication that doctors are giving a lot of patients to help them to reverse diabetes and also to lose weight. And this medication is Ozempic. It is also known as Wegovy, and I want to give my thoughts on that after some time of investigation and research. And I want to answer the question of how this medication should be administered, and if it's right for it to even be administered, and what are the guidelines of that, and who should particularly qualify, or who should be I guess the person that decides that this is okay for them and who shouldn't be. And I want to kind of dissect and give some thoughts on that according to science and research and what's been discovered. Now, I do want to say that there isn't, a full context of data out there that can give a super fortified opinion on it. But what I can say is that based off of what we have now, I want to shed some light and give some information about it and some awareness concerning it, so that you as a consumer can have the education and you can have at least the full comprehension of the current moment to be able to dictate whether or not you want to take this medicine or whether or not it's good for you. And so, again, I'll give some understanding and some guidelines to what my thoughts are about that. And again, all of this is due to research and case studies and, investigation over several years of looking into this particular medicine. But I want to start with just zoning in on our approach to longevity and health, and again, reversing chronic disease. Now, I want to stop and just say, make sure that you subscribe to this podcast, because there's a lot of people that will listen and they will watch and they still will not subscribe, even if the content is valuable to them. And often people will even share the information without subscribing. So I want you to take a moment to do that, because this is a community where we're going to learn and grow on how to live a successful life in the area of our health and our well-being overall, which plays a huge role in our experience of life. And I'm here to give the science, the research, and the education that is needed for you to optimize your health as best as you can. So please make sure that you do me this favor and subscribe. I look forward to the journey of making sure that I get the information out that you absolutely need, that you can take, and you can utilize the resource for your entire life. And so thank you for that. Now, I just want to start off by understanding that we are in a time of distraction when it comes to all of the resources, seemingly resources that are given for us to optimize our health. And I just want to talk about this approach and this idea that's been fed to us over the years concerning our health and what we should do to make sure that we're making the appropriate decisions to honestly live a better quality life, especially as we age and as we get into the last 10 years of our life. That is something that you really want to think about is the approach for conventional medicine, is it working? And I mean, is it working as a whole, as a system that's given to us as individuals to help us to create a better life? Ultimately, that's why we want to be healthy, so that we can be around longer. We can, have the energy to optimize our well-being and our relationships and our career and our purpose and why we were even born. And so I find that this topic of health is very important, and we need to dissect if it's working, because if it's not working, then we need to find a better solution. And I think that there is a bit of frustration with the fact that the medical industry is, spoon feeding us information that is half-baked and that is not giving us the full picture. And if we don't have the full picture, then we can't make reasonable decisions with our health. What I do know is that things are getting worse. And the reason why this is so important is because 1 in 8 people, Americans specifically, are considered healthy. And so that means that only 12% of the population of Americans are healthy. And that we have to change, because that is just not going to work for us, right? And it shouldn't work for anybody. I mean, we need to be concerned about what is being painted for us. And even worse than that, there are people who look at, hey, I need to be at a healthy weight. I need to make sure that that's at least where I start. And that's usually where a lot of people start, is that I'm overweight. And that's how they usually identify that something is wrong, is because they are overweight. And the truth be told is that even people who have a healthy weight, and I don't even like using that term healthy weight, because I don't know if there's a such thing as a healthy weight more than it is a healthy person, a healthy human being. And you want to make sure that you are becoming a healthy human being and that your weight reflects that, right? And so even when it comes to being overweight, often that is a symptom of a problem that's usually happening within. But here's the trick. People who even have healthy weights, 2/3 of those people are still metabolically unhealthy. And so we definitely have to understand that it's not just about the weight. And I'll talk later on in a minute about this medicine, Ozempic and Wegovy, that's trying to help people to get to a better weight. But is it obtaining the outcome of leading them to become a healthy person? That's the question that we have to ask. And often this entire process of, our well-being and how do we construct a life that allows us to live at a high level of capacity of output and, an experience, because of course our experience is compromised when we're unhealthy. If we don't have energy levels that we need, if we are in pain and we have chronic inflammation and we have a disease and we got to go back and forth to the doctor, or we are stuck on dialysis, or whatever that may look like for you, it's going to cause some problems. So we have to understand how medicine and some of these things that we're using to try to, quote unquote, get healthy, how it's interrupting the balance and the natural flow of our physiological makeup, right? And so first we need to start by understanding that too many people are sick, and the guidelines that have been given to us have not been working. That means that we have to find a different solution. Even when we look at the pyramid and what's been given to us to eat a healthy or a human-based diet, something's off. Something's off when people are following the guidelines and then they're still getting sicker and sicker. For example, and this is not against anybody who has this particular diet, but I would often ask people questions like, what kind of protein do you eat, for example, especially when I have clients. And sometimes they'll say, well, I eat, chicken, I eat fish, I eat a lot of vegetables, I think I'm eating healthy, but for some reason I still struggle with diabetes and high blood pressure. I don't eat any red meat, and, maybe I've come off a little bit of sugar. I only eat fruit, or I eat, just whole grains. And I'll ask them, for example, I'll say, so you don't eat red meat? And it's like, yes. And I'll say, like, well, why don't you eat red meat? Because I want to know why. And they'll explain to me, well, it causes heart problems or something. And then I'll say, do you eat potatoes and rice? And sometimes do you eat dessert? And it's like, yeah, I eat potatoes, I eat rice, I eat dessert from time to time. Do you drink Starbucks? Yeah, I drink Starbucks. Do you put, the extra, pumps of syrup in there? Well, yeah, sometimes I take a caramel macchiato or something. And it's like, so you have a chronic disease, you eat potatoes and rice and sometimes bread and whole wheat, and maybe you're eating, some other, carbs or sugar. You're eating fruit, you drink Starbucks and you got an extra pump of vanilla syrup, but you don't eat meat. That's right. But you have a chronic disease, right? Yeah, I have a chronic disease. Well, something's wrong with that. I'm not going to tell you what is, but if it's not working and you still have a chronic disease, and this has been going on for like the last 3 years, then something is wrong. So first, we just have to take a moment and just take a step back and figure out, okay, whatever it is that I'm doing that I think is right, why do I still have these issues? And it's not like I only had these issues 3 months ago. It's like I've had this issue for 5 years, or I've been on medication for 10 years. Like, these are the kind of clients that I approach. And I walk around and I might see somebody who's like, yeah, I do this diet or I do that diet, right? And then they are eating and drinking, corn fructose syrup. And it's like, it's all based on the fact that they told you that this one thing is wrong and they distracted you. And now you have excluded this from your diet, but you're still eating a diet that probably has you pretty much addicted to sugar mainly. And so you got to understand that there has been a distraction made that keeps people still hooked on sugar and processed foods. And we're making things the villain. And then when doctors figure out, okay, you can't solve this, now that's when they shove another medicine option your way, just again to make the numbers well. This isn't working, and we have to untangle it, and we have to take a step back and make sure that we understand what we need to do in order to fix this issue. And most doctors, again, another distraction is that they tend to feed your way, oh, this is genetic, right? And a lot of people do think that some of their problems are genetic. A lot of people think diabetes is genetic. And of course you think it's genetic when even you have tried everything you needed to try and it doesn't work. And then we give you a medicine and then now the numbers get fixed. And so you're like, see, I knew it because I tried all of this other stuff that I thought was the right process and it didn't work. And all of the fads out there, the diets, and I've done everything and I couldn't get it to work. And now this medicine makes it work. That's because it's a genetic disposition and I need medicine for it to work. But the problem with that is you never probably had the correct information in the first place. Because when you go to the doctor and you have high cholesterol issues, instead of them dissecting what's going on with your cholesterol, because there's a puzzle that needs to be, put together often when it comes to LDL levels, triglycerides, and HDL levels. Instead, they just look at a number and they'll say, hey, you need to be on, statin drugs. And they are not going to dissect, hey, but does this person have good triglycerides levels, meaning low, or do they have high HDL? And, then look at the pattern of the LDL. They're not going to take time to do that. They're just going to, shove medicine your way. And then they'll probably tell you, you need to be on a low cholesterol diet. So then you go on a low cholesterol diet and that doesn't work because they try to get you to go on a low cholesterol diet to fix a triglyceride issue. And triglyceride issues are not cholesterol issues. They're sugar issues. LDL is cholesterol issues. And so, or I'll just say fat issue, the issue of maybe eating, more fatty meats or something. And so instead, to get your triglycerides down, they may tell you to go on a low-fat diet and not eat the meat, and the meat is not causing the triglyceride issues. And so we have a huge problem because you're getting fed the wrong information, and then when you get fed the wrong information, you can't fix the problem. And if you can't fix the problem, then you're more apt to go to medicine. And then when medicine makes the numbers good, you feel like this is reinforcement of the fact that it's genetic because I couldn't fix it. And usually when something is genetic, it's much harder for you to be able to fix it, but really that's a distraction. And so there's a lot of distraction around conventional medicine and what normal doctors are feeding the community, right? And let me just pause by saying there are some super intelligent doctors who do their research and who take time to investigate what works and what don't work. So I'm excluding those type of doctors. I'm talking about the doctor that when you even tell them and give them feedback about how this medicine is working for you or how this diet is working for you, or, hey, I went on a low diet, I'm taking this medicine, now I feel brain fog, I don't have energy. They don't even have enough time to document that in the system. So then they're not even collecting real evidence and real feedback from actual patients. Like, this is considered case study, And so then we approach this where most diseases we think are genetic and they're actually metabolic. And so now the doctor isn't going to give you the aim of, hey, this is a metabolic issue. And oftentimes this is an environmental issue. This is a cultural issue, meaning that if you're mom and your grandmom and your cousin and your aunt who get together and eat the same meal, if they wind up having diabetes, you think, I'm going to have diabetes because my aunt has it, my mom has it, my dad, had this happen because of it. And you just kind of think that it's something that's automatically going to hit you. The problem with that is that most of it is not about it being genetic, and there's a small portion of genetic activity that happens with people. So I'm not talking about the other variabilities or the variances of this information, but I am saying that what's genetic in a sense is the habits that you grow up mimicking from your family members. And so if they're eating dessert after every meal, you're going to start eating dessert after every meal because the culture is stronger than willpower often. And so you have to understand that you picked up habits that are similar to the people around you who wind up with these same diseases like hypertension and diabetes. And culture is much more powerful than your ability to make decisions. And that is why even when we look at, for example, the Bible, when Jesus was going into certain cultures to try to perform miracles as the anointed one, he could not perform them because of the culture of unbelief. And so here we have the anointed one who's going in a culture and who cannot activate the actual gift that's within him to be able to release to the people because they can't receive it and they do not believe. And so now he's restricted. And he's not restricted because he doesn't have the capability or he doesn't have the potential to be able to operate in this capacity, because we've seen it in other times in his life, right? We've been able to hear and read about it in other times of his life, but there's certain places that he was restricted in being able to do the same thing that he could go into another environment and do. And so I bring that point up just to say how powerful culture can be, because sometimes you'll go into a culture and think that you can change things and change everybody and convince everybody of what, is to be accepted or the truth or whatever. And it's much harder than what you think. And so if that be the case, then even you yourself, when you go into an environment, you think that you can have greater control over the environment. And it is very hard because you are up against a mountain. You are up against Goliath. And unless you get the proper reasonable knowledge to be able to make the choice, then you are going to be prohibited often from making that choice. So now you're in the culture where everybody's doing the same thing and you don't have the knowledge to do anything different. Well, this is why it's hard to make people totally responsible for the decisions that they're making with their health. Because in order to make a reasonable, intelligent decision, you have to have the appropriate knowledge available to then make the right choice. And if you don't have that, then people can't make the right choice. So there's a part of me that doesn't feel like people are responsible all the time for where they end up in their health because of the marketing schemes, the political schemes, the money schemes that industries have that are even promoting, certain foods, for example, that are addictive. And, a lot of these industries, a lot of these food organizations can even hire, a chemist to make sure that they're putting stuff in the food that makes you addicted. And it's being promoted everywhere. When you go to the, cash register, even to check out, they're like, I want to just try to convince you one last time to get something that's unhealthy for you. Grab this Snickers or, this bag of chips. And it's just everywhere. And it's so hard to get out of the entanglement of this system. And so you do have to be empowered with the right information. And that's why I love doing what I do, because I do try to investigate and research and follow case studies and do whatever I can to learn so that I can at least bring the information that's been learned from the other side of the mountain and, allow those who listen to have another option. This creates opportunity. It's intercession. It's intervention, because we need it, because we've only been, presented with one side when it comes to the media even. Like all of these trillions of dollars that we are spending on, for example, Ozempic or, Wegovy, why can't we spend some of this money on trying to make sure that there's proper food in place? There's whole foods that people can eat. It's a distraction. And so here we are, fixing things with a Band-Aid. And that becomes an issue again, because it reinforces that the problem isn't really the problem. And we come up with different conclusions when we see that things are getting better. And there are some very desperate people who are in great need to try to fix their health. And so, yeah, they're going to take anything that they're given, especially from a doctor. And so we have to be very careful about what we are paying attention to when it comes to doctors, because they're a bit biased at times, and they don't necessarily have the consumer's well-being at heart. As a matter of fact, they make more money if the consumer stays sick and dependent on medication. I have clients that are on dialysis and don't even know their kidney numbers. The doctors haven't released to them GFR numbers or anything. They don't even know it. And I'm like, what are your numbers? The doctor didn't give them to me, or they didn't take them. Well, why are you on dialysis if you don't know your numbers? Like, what if you're on dialysis and you don't need to be? Well, they don't even know, because the doctor is not trying to educate them. Dialysis is a multi-million, billion-dollar industry. And I'm not saying people don't need to be on them because their kidneys aren't damaged. I'm just saying that the doctors are not letting them know on the onset of whatever the disease is, if this is something that's going to damage them down the line. I have a lot of clients who have high blood pressure issues and diabetes. And I asked them, has your doctor talked to you about kidney damage from this chronic disease? Or has your doctor talked to you about, the potential increase of risk of cancer and Alzheimer's? And they haven't. They haven't even mentioned it, not once. And I even had a client who said that, I want to say their mom was almost put on dialysis because she was on a medication that was causing kidney interruption. And so from the medication, when she got her kidney numbers back, they didn't identify that it was coming from the medication, so they were going to put her on dialysis. But instead, they had a thought that the kidney damage was coming from the medication, because there was no problems with her kidney before she took this medication. And so they took her off for a little bit of time, and then they retested her and got a second opinion also. And her kidney function was just fine after she came off the medicine. But here's a doctor about to put her on dialysis and didn't even check to see what the side effects of the medicine was. And I've ran into all kind of stories that is very similar. I even ran into a guy who was totally disgusted because he used to sit at the table with surgeons who bragged about doing surgeries that they never needed to do on patients and how much money they made from it. And he said he was absolutely disgusted by it and had to, at one point, leave like a dinner meeting with doctors because he couldn't take it anymore. And this kind of stuff is real. You know, I've ran into doctors that did damage and, you know, didn't even ask any questions before they wanted to just put me on medicine. And then when something really is wrong, it takes them a long time to really listen. I kind of tried to beg a doctor to, you know, give me a MRI and some tests because I felt like the pain that I had in my neck was so bad. I just knew I had some really bad bulging discs, some slip discs. Something wasn't right when I could barely get up out of bed with pain. And it took me about 6 weeks fighting with them to finally get a test done. But in those 6 weeks, they tried to beg me to take steroid shots. Well, how are you going to give me steroid shots and you don't even know what the problem is? What is your differential diagnosis as to what it is or what it isn't? When you go to the doctor and you're telling them something's wrong, you know, and they don't listen, you need to ask them, what is your differential diagnosis? Because have you tested me to make sure this wasn't a heart attack? Have you tested me to make sure my arteries aren't clogged or something, you know, I don't have cancer? One lady actually, after 2 years of begging for tests because something wasn't right, she started to get symptoms that just seemed out of alignment with her body and her well-being. And then she found out 2 years later she had pancreatic cancer and they never wanted to test her. And this has become a problem, you know, with trying to force doctors to really hear us. But then on the flip side, when something, you know, they don't even know what's wrong half the time and they're just doling medicine out to you. Ozempic, for example, is really supposed to be used for people who are diabetics. But what happened was they started to find out that it was, you know, causing weight loss. And so that's why they decided, okay, if a little dose is causing weight loss, let's just take that medicine and the part that's causing weight loss and let's move it to Wegovy. That's the medication now that they use for weight loss. And let's increase the dosage so that we can get more weight loss. That's pretty much how they came up with this whole weight loss idea. And I'll get into that in just a minute. But I want to explain that when you go to the doctor, we're at a time where we have to fight for our health, right? And so even when it comes to like certain jabs, you know, for the flu, I have to fight with my doctor to not give these flu jabs to me or my children. And sometimes they'll look at me like I'm an unfit mom. I've had to fight with them because they wanted to give them to me and my kids. And I'm like, no, I don't want this, you know, this shot because there's a lot of things in it that I don't agree with. And quite frankly, if you can't tell me the ingredients in this shot, I don't want it, because when I eat food, I can look on the back and see what ingredients I'm at least putting in my body. And when I ask you what's in it, you can't tell me. Even though I've looked and investigated what's inside of these shots, but I don't want it, and I don't want my kids to have it. And they're like, you know, they're kind of looking at me like I'm just, you know, just such a horrible mom, like I'm putting them in such danger. I honestly haven't, and I pray that I don't, but I honestly haven't had the flu in 25 years, I want to say. I'm trying to do the math in my head. Yeah, almost 25 years, somewhere between 20 and 25 years. And so you would think that if I tell the doctor, listen, I've come up with a way to minimize my risk of catching this virus, or at least having the symptoms of it, especially with just taking vitamin D supplements and trying to make sure that I'm being well with my overall health. Why are you fighting me on this? If I'm telling you I haven't had the flu in almost 25 years, what would be your reason for fighting with me on this, unless you have some kind of gain involved? And not only that, like the last time I actually got it is when I had the flu shot. Go figure. I got it right after, 3 months later, or maybe not 3 months later, maybe right away, maybe a month or something later. I know it was right after I got the flu shot. And so I don't know if doctors always have your best interests at hand. You know, just from having to fight at stuff like that. I almost died too one time giving birth to my child because the doctor over-medicated me and numbed me too much because they overestimated my weight. And it was a bad experience, actually, because I couldn't breathe. And I was numbed all the way down through my chest, and I could barely, I was panting for air because I couldn't breathe because they over, like I said, gave me the medicine. And so they had to give me something to reverse it and change my position to make the medicine come down from, it had reached all the way to the top of my head. Actually, I couldn't even blink. I couldn't even move my eyes or my lips to say anything. Actually, that's how bad I was paralyzed, is that as it rose up, because like I said, it was too much. It rose up to the point where I started to, look to my husband and tell him, I can't breathe. I can't move my chest to breathe. Something's not right. And as I started saying it, it went up and I couldn't even move my lips. And they eventually figured out what was happening because I couldn't say anything because I was paralyzed. And they went to reverse it real quick. It was the most horrific moment of my life in the middle of giving birth to my son. Imagine feeling like someone has sunk you in the water and pushed your head down under and you can't breathe. Like, it was so horrible. I thought I was going to die. I was trying to tell my husband, take care of the baby, like literally giving last words because I knew I couldn't breathe. And so there's a lot that goes wrong sometimes. And I just think doctors, if they could just do this one thing, listen to your patient. Listen to your patient. Like, that's the least you can do as a doctor. We're in this together, right? You have to listen. You cannot force your agenda, especially when things are not working right. And I mentioned something earlier about cholesterol. I have not seen anything more damaging than how many times doctors try to put patients on cholesterol medicine. Cholesterol is something that you have to analyze. And so here's the thing about cholesterol is that you could have a cholesterol number, which hasn't had much research attached to heart disease, just the cholesterol number in and of itself. What is attached to heart problems and increases your risk for heart disease is having high triglycerides and low HDL levels, particularly, I want to say for women under 50, having low HDL numbers. I want to say under 50 and maybe men under 40. And then having high triglyceride levels. And then you can look at the LDL number and see, is that a good pattern or a bad pattern? You have to look at the triglycerides and the HDL to see what pattern the LDL is. They don't care. You got high LDL levels, that's it. You're on medication. You got high cholesterol levels, that's it. You're on medication. Doesn't even matter about the other numbers. But on a science level, what they've investigated and started to look at is that, honestly, people with a healthy pattern where they have low triglycerides and high HDL levels, their LDL levels, even at 200 or 250, is not dangerous. And actually, they found with that pattern that people who had higher LDL levels with that pattern is healthier or live longer than those who have very low LDL levels. And so I get that doctors may be afraid and just see a number that's high and just, like, hey, just get on medicine and make it okay. But they have to take the time to figure things out and make sure that they're doing the right thing for their patient. Because it's all about, is this right for the patient and what's the risk factors that are involved? And a lot of doctors are not considering that, right? And so when we look at cholesterol, also the doctor will say, okay, your cholesterol is high, so we have to lower your cholesterol. So we want you to stop eating eggs and stop eating any type of food that has cholesterol in it. And what they don't realize is that the cholesterol is not causing the high cholesterol. Food cholesterol and blood cholesterol are totally different. And as a matter of fact, when we're looking at triglycerides, which is one of the markers that is looked at when it comes to metabolic disease, triglycerides are not affected by cholesterol in food. They're affected by sugar and carbs, right? And so why doctors don't understand this, I don't understand. I don't know. What I do know is that they have limited knowledge and they don't get taught this stuff in medical school, because a lot of doctors say it. When they're finally realizing, I feel like I'm making my clients worse or making my patients worse, something's wrong. I need to reverse what I'm learning. And then when they go and learn the right way, or they start to look at the science and the data and, pay attention to what works, what doesn't, then they realize, wow, I wasn't taught this when I went to med school. And I actually have somebody in med school right now, and I told them, send me your classes. What are they teaching you guys? Like, let me see, are they teaching you natural alternatives to medicine? Like, what do those classes look like? Because I'm just curious, because there's a lot of doctors that say they don't learn this stuff in medical school. And actually, medical school may have even messed them up, honestly. So they're limited, and then they're also limited in time. You got to remember, the success of a doctor is how quick they can get you in and then out, okay? And then if we put you on medication, you're going to be happy, I'm going to be happy, numbers are going to look good, we're all good. But they don't understand that there is still some underlying conditions that is not being addressed, and if you don't fix those problems, what's going to happen is later on, you're going to have even more problems, and then you're going to have to take even more medication, and you're going to be in a bunny trail, just going down, taking medication, this medication for that medication for this, and then the medication is causing problems with your body and have side effects that they don't talk about all the time. And so it's really like a sinking sand process. And even if you look on the TV, like when they throw medicine out, I mean, they'll have people running around in the commercial, and they're in the sun, and they're doing flips and, holding hands and, singing, happy song, like this big happy picture that you're going to be taking medicine. So first of all, it's painted differently because you are smiling, watching the media paint the picture of taking medicine like it's a great thing. Like, this is your best life. Enter into this zone and you'll be happy, And like I said, just pay attention. Everybody's happy. Family looks good. It's always bright. The sun is shining, moving around in a circle on the grass. I mean, it's like being painted like this is the perfect life to be on this medication. Now, of course, I know that they're trying to paint the picture that you're going to have these results from this medication, but it's a marketing scam, first of all, to like make you feel like, okay, that's what I want to feel like, so I need to take this medication to feel like it, right? And so they paint this big, beautiful picture of success and happiness and joy and peace, and you're going to just gain back your life from this, right? And then at the end, here he comes really quickly, with small words at the bottom. Oh, and by the way, may cause, heart problems, palpitations, anxiety, heart, high blood pressure, diabetes, erectile dysfunction, loss of hearing, loss of taste, and even death. Like, at the end, they come with all of this stuff that we pretty much missed out on because we got painted this beautiful picture. And now they're going to come with all of this stuff at the end, may even cause cancer, And so, okay, now we traded in one problem for another problem. And listen, they need to just be clear. Listen, we have people who wind up with problems when they get on this medication. So we're going to restrict the process, and we're going to use the full context of the information and produce a reputable, intelligent program for you that can help to fix the problem in the immediate terms, but we're creating a longevity blueprint for you to break out of this and make sure that you can reverse this problem and manage it so that you don't get stuck on medication for the rest of your life. So I'm not against medication. Like, medication is needed for certain people at certain times. And it shouldn't always be this long-term thing unless you're really dealing with some real serious issue or maybe a genetic problem or something that medicine is going to give you back more days than take away your days. And that's where the risk factor comes in. And so that's why I want to talk about the Ozempic and the Wegovy medicine and my thoughts on it and how it should be administered. Should you take it or should you not? And what are the guidelines if you do take it, right? And so, first of all, I do think it is another distraction because we're using this as a solution to be able to lose weight. But in the middle parts of that, we are putting our bodies into starvation mode when the shot is given. So how it works is that, just on a general basis, is that when you take this particular shot, now Ozempic is the shot that's given to help with A1C levels for diabetics, but then Wegovy was used just specifically for those who have weight problems. And there was some conflict about, since a lot of people wanted it for weight loss, Ozempic to be clear, then so much of it was used that people who had diabetes could not use it. Well, I would say don't get mad at the people who took Ozempic. Like, when you're faced with a problem with your own health and you're scared and you are looking for a solution and your doctor starts to share this information with you, sometimes you're misled. And so some people took it being misled from the information. And they're not told like, oh, if you take this, then that means we're going to have a shortage for diabetics. That's not the motive usually for people taking it. And so I don't think that we should be harsh about people who were taking Ozempic for weight loss and it minimized the chances of people who had diabetes, to take it. And that's been an argument back and forth and a conflict. But nevertheless, a lot of times the doctors didn't say, hey, we have Wegovy that is meant for weight loss. And so how it works is that it makes you full. It makes you feel like you've already eaten. And so then because of that, you don't eat because you're full. So it makes your body feel like you're starving. But how healthy is it to make your body starve or to go through starvation? How healthy is that? Because when you're going through starvation, there's some nutrient deficiencies that start to happen and your body starts to pull nutrients from other areas because it's prioritizing the fact that you're starving. And so it makes you eat less food. And when you eat less food, you have less calories. And so then if you're taking the shot and you're eating less food, less calories, but then you're eating the same thing that you would normally eat and your numbers are getting better, then you're thinking, see, once again, this reinforcement of it wasn't me, I'm not the problem. Like, this problem is beyond me being able to change it on my own because now I'm eating the same thing, but I'm getting results because of this medicine. But you also got to think, because you're eating the same thing, then whatever's happening underneath the surface is still not getting fixed. And guess what? The moment you come off of it, because you've restricted your calories, then you got to understand that you'll probably gain the weight back because now you're going to start eating normal and you're going to start eating the same thing. And the reason why you may have wound up in that situation is because of some dietary issues. And so then you yo-yo back and forth. But then there's also some idea of what are the long-term effects, because there has not been any long-term studies of Ozempic. And so now you have to wonder, how do we get the information from a long-term position? Well, how we're getting the information is those who decide to take it are signing themselves up for the study. So they're the ones saying, hey, I'm going to sign up for this. And not intentionally, but unintentionally, they're saying, I'm signing up to see what the side effects are, what the rewards are, the gains, the losses. And then what people are going to do is kind of sit back and pay attention to what that looks like. And that's how we're going to get the long-term results, is from looking at the people who are currently taking it, because there are no long-term studies done on this particular medicine, which is kind of scary, right? Because 5 years down the line, if we start to see problems that's happening, then it's already too late for the current people who have been taking it long term. Or even if they took it short term, but then we still see later on down the line that there was some difficulties. Now, there are still, even now, some side effects to Ozempic that are being reported, but we're not going to know everything because remember, the doctor doesn't have time to report all your complaints about this medicine. And obviously, they're probably only going to give you the good results, which is that a lot of my patients lose weight on this medicine. But if you come back and you say, well, I had some gut issues, I had, my energy, I had vomiting, I lost my strength, they're probably not going to put that in the system because their whole agenda is to push this medicine. And so there are some statistical outcomes from taking this medicine where it begins to change your physiology. All right. And I'll help you to understand that because we have a peptide called glucagon-like peptide. That's GLP-1. And GLP-1 is a neurotransmitter that is released in healthy humans, right? And we find it mainly in the gut area. Now, what Ozempic or Wegovy is it's basically a synthetic form of this in high dosages, right? And so when you have large dosages of this, what happens is it starts to act like a synthetic hormone. And it goes into other areas, obviously, of the body if there's an accumulation of it. And the main thing is that it begins to bypass the vagus nerve. Now, I want you to understand this so you can understand where the physiological change comes into place. Because the vagus nerve is, on basic level, a nerve that allows the brain to communicate with the gut. And so what happens is you're passing this gut-brain barrier that involves the vagus nerve system. Now, let me explain to you why this is super important. The vagus nerve system is highly responsible for the autonomic nervous system. And the autonomic nervous system is responsible for a lot of things in your body that you don't even think about, like digestion, blinking, pulse, bladder, breathing, your eyes dilating and constricting, like all of these things that you just kind of do without thinking about it. And it also plays a role in skeletal muscle, which is very important because I'm going to talk about that in a minute. And so the autonomic nervous system is comprised of two different systems that are regulated, which is the sympathetic system and the parasympathetic system. The parasympathetic system is the counterbalance to the sympathetic system. The sympathetic system is the fight or flight system. And so it's the system that helps to protect you from like danger. So if a bear or a tiger or a lion came running in the room, you would immediately do whatever it takes to protect yourself. And so that's the sympathetic system, which we find those who have higher levels of chronic disease, they are usually regulated by the sympathetic system. They are usually regulated by the sympathetic system. The parasympathetic system is used for rest and digest and healing and recovery. And so you need the balance of both of those in order to stay well. And again, usually people who have chronic disease, they usually operate out of the sympathetic system a lot more than the parasympathetic system. And I find this with my clients is that we have to get their parasympathetic system to be activated to help the healing and the recovery process. Now, when you bypass the vagus nerve, you are basically not allowing your body to use that nerve in context to balancing the autonomic nervous system and making sure that both the sympathetic and the parasympathetic system is being utilized. And what happens is the vagus nerve is like that nerve where you don't use it, you lose it. And so what happens is you wind up having vagus nerve dysfunction, and it winds up ending in you using and utilizing your sympathetic system a lot more. And so you're not going to be a healthy human being if you are utilizing the sympathetic system and not being able to utilize the parasympathetic system. And so when you bypass even that communication that's happening, then that's why you're starting to see some level of damage often for those who do take Ozempic, like, for example, this idea of gut paralysis. And so one of the side effects that's happening is that their gut or their digestion gets paralyzed and they can't digest the food properly. So a lot of people wind up having a lot of nausea and vomiting and constipation, and even some with diarrhea. And even after taking it, they're having these problems. And as a matter of fact, we're starting to see and get the feedback that people who stop taking it, they still feel this sense of like fullness and almost like a disgust with food. Like they can't, it makes them sick and nauseated to even think about food. And again, when you bypass that barrier of that communication going back and forth from the brain to the gut, it's going to cause a disruption in your physiological makeup. And that's what happens when you're given the synthetic version of the glucagon-like peptide, the GLP-1. So the overabundance of this GLP-1 is causing you to not utilize the vagus nerve system to communicate from the brain to the gut properly. And now the gut is left in disarray because there is a dysfunction of the vagus nerve in the brain. Now, there's a lot of other things that can happen also with this, and there's a lot of other feedback that's given from Ozempic that's a cause for concern. What we're seeing now is that healthier people are getting actually better results from the weight loss from the Ozempic and the Wegovy. And people who are extremely overweight or who have some complications with chronic disease are not getting as good results, right? And what the research is finding is that the healthier people are getting greater results because they don't have the GLP-1 resistance, the glucagon-like peptide 1 resistance. So because they don't have that resistance, the medicine is working a little bit better for them. However, these are people whose vagus nerve is working just fine. And so they are activated with being able to utilize their autonomic nervous system with balance, and they're able to stabilize between the sympathetic and the parasympathetic system. And remember, again, the parasympathetic system is the recovery, the healing, the balancing of things, right? And so their bodies is able to utilize this medicine currently to get the best results. But what it's looking like is that on a longevity level, they may have the greater damage to their body because they originally, on a metabolic level, is healthier and their vagus nerve is healthy, but now they're making it dysfunctional. So now, after taking the medicine, their autonomic nervous system is going to be compromised because of the dysfunction with the vagus nerve. And so that becomes an issue on a metabolic level because remember, I mentioned before that the autonomic nervous system also and the vagus nerve plays a role in skeletal muscle. And so are they compromising their ability to be able to build muscle in the future is the question. when it comes to taking the Ozempic medicine. Now, people who have already damaged their vagus nerve and they are not metabolically healthy, they may not get results, but maybe they won't see as much long-term damage because they're already undergoing vagus nerve dysfunction and their body not being able to balance the autonomic nervous system between the sympathetic system and the parasympathetic system. But those who are healthy are compromising themselves. So that's a problem because being able to build muscle helps with anti-aging and longevity. Now, in simple terms, when you are taking something that is decreasing your calorie intake because it's making you full and you're not eating properly the amount of calories you're supposed to eat, number one, there's an issue with nutritional deficiency. And number two, when you do restrict calories, it does start to strip away at your muscle. And so one of the things that has been found with Ozempic medicine is that maybe about 40% of the weight loss is coming from muscle loss. So now you are taking away muscle from the body, and now you are compromising the vagus nerve and making it dysfunctional so that it affects the autonomic nervous system so that the body is not able to properly, potentially add skeletal muscle to your body. So not only are you losing muscle, but you're compromising your body's ability to build muscle. And that becomes a problem. And so when we look at this issue of muscle loss, it's making people look better in a bathing suit, but it is not making better your life in the future or the potential of aging you and deteriorating your body quicker. Because even in adults that are over 65 years of age, if they start to lose too much muscle mass, they actually die. That accelerates your aging. That messes you up for your ability to have a healthy immune system, to help with your joints, to help with making sure that you stay youthful, your skin. That's why some people are losing even the muscle in their face and extra fat in their face that their face needs. It's called the Ozempic face, and it's starting to show in the face and make people look like they're losing even skeletal muscles in the face. And so these are some of the things that have been found. And here's another thing and another problem that we have to identify with is that when it comes to glucagon-like peptide 1, you find the receptors in a lot of places in the body. Now, remember, most of it naturally is found in the gut. And this is naturally. And so when you're feeding it mass amounts of synthetic GLP-1, then you have to wonder what other areas are going to be compromised, because I'm going to name off a list of where other receptors are found in the body for glucagon-like peptide 1. There are receptors in the brain. There's receptors in the gut, in the kidneys, some found in the heart, the lungs, the immune system, and the nervous system. So now what we have to figure out is that because there are receptors found in these different areas, will these different areas be affected in the long term from Ozempic or from Wegovy? So that could be neurological damage, and that's where the feedback is important, because that's what we're starting to see, that there could be cognitive problems, there could be gut problems, of course, kidney problems, there could be heart problems that's associated with it, lung problems, problems with your overall immune system, your nervous system. Like, that's what we're going to be trying to find out based on the data from people who are taking it currently. And there have yet been no answers to that. And then also, there's been some reports of a possibility of it causing thyroid cancer. I know somebody actually who took Ozempic for a year. Now, I'm not making the connection, but they took Ozempic for a year and they currently have thyroid cancer. I'm not making the connection. I'm just giving you some facts. So you might want to wonder, did it come from that or didn't it? It's very hard to tell right now until there's enough data to be able to understand that. And so, do I think people should take Ozempic? And if so, how should it be administered? There are people who are desperate for weight loss solutions. And I totally understand that. And so my thought is, if you are going to take Ozempic, and if it is appropriate for you, I do think that your doctor should weigh the risk factor from patient to patient, because it changes depending on the person. I do not think that if you are a pretty healthy person and you don't have an extreme case of weight problems, meaning that you could potentially do it naturally, and you don't lean to just taking Ozempic just to lose a quick, 10 to 15 pounds, I don't think you should take it if you're healthy. And some people do it because they're like, oh, look, I, lost 10 pounds in, a week or two to fit into this wedding dress or to fit into this bathing suit. I don't think you should take it because of the potential risks that come with affecting your autonomic nervous system and your body's ability to communicate with so many areas of your body, because of compromising the brain's ability to communicate with the rest of your body through the vagus nerve, which becomes dysfunctional due to this particular medicine. This part of your brain controls too many things that we are dependent on. And so you don't want to be caught in a situation where your body is metabolically healthy and now you're creating yourself to be unhealthy because you want to take this shot to lose a few pounds. Because at the end of the day, it could potentially make you insulin resistant, and it could affect other areas like high blood pressure. And you might begin to see some people who didn't have any metabolic problems who took this shot for a period of time, and now they do have problems from it. Now, if you are someone who have extreme weight problems and you've tried everything possible and you do want to take this particular medicine, and I'm giving my opinion here, I'm not giving facts, I think that you should do it under the guidelines of making sure that you have a long-term game plan for your weight issues, because usually weight issues are a result of something deeper happening in the body. And I think you should have a game plan for your nutrition and also a game plan for your exercise routine and your fitness levels and how you can do things that can help the body to build muscle, because there will be some muscle loss when you take this particular shot. And that has been proven with studies so far, is that you're losing muscle. And that can compromise your longevity. So you want to balance that with making sure that you have an exercise routine in place that can help you to build muscle. And then also, it would be great to prioritize your nutrients. So making sure that you are getting enough protein and healthy fats in your diet is important, because if you take this shot and you're still eating the same way, then you're going to have issues still with addictions and just the habit of eating processed unhealthy foods. And fructose can still damage your body and your liver. So you're not really fixing the problem. And if you're going to go ahead and take it, then you still need to have a game plan in place to be well and to be healthy. Because if you can get a game plan to become healthy and to reverse some of the chronic damage, then you can set up your future a little bit better, because you're already up against the side effects of this particular medicine. But I do not think it should be long term. I do think that if you take it, you need to be able to have a strategy in place to wean off of it and not to cause too much damage to your body. With knowing that Ozempic is taking away muscle mass from your body, you don't want that to happen at large amounts. So if you're going to take this particular medicine, then you do need to have a restrictive way of taking it, in a way where you're only losing maybe 1 to 2 pounds every week, instead of these large dramatic amounts that some people are having. Because your body's ability to maintain and balance this weight coming off needs to be a little bit more near natural. And so if you're taking it and you are taking it in dosages that are not super aggressive, and you have a plan in place to do a bit of work yourself with your eating and your exercising and lifestyle changes, then that combination can really help to set you up for a good process where maybe this particular medicine is helping to aid you in the process of your own health journey. And then you can kind of easily wean off a little bit better and more efficiently, and then continue the habits that you have changed along the way while getting a little bit of help. That is very different from a person taking Ozempic or Wegovy and just eating whatever they want, not exercising, and just using it to lose weight and to do the fast route. And some people have said, I'm not exercising, I'm not doing anything because I'm losing weight, and this has made it easier for me to not have any changes in my lifestyle. You don't want to use it in a way that is enabling you to stick to unhealthy choices that are going to still harm you down the future. Losing weight does not mean that you're getting healthier. Losing weight does not mean that you are being set up for longevity. So you must understand this if you are going to choose to take this medicine. And the more information you have about the full context of it, the better you will be. Now, what I will talk about in another episode, and in the next episode actually, is I will talk about how to stop and reverse your aging and even reverse chronic disease, and what are the simple steps that you can take to reverse your chronic disease for those who do not want to have this intervention or possibly compromise their longevity and their future. There are some things that you can do to turn the tables on metabolic symptoms and dysfunction. And these are things that have been proven to help with thousands and thousands of people. I use a lot of these systems and guidelines on my clients, and we have seen a tremendous change in reversing disease. And so I want to give you some of those strategies so that you can take them and you can reverse the damage that's been done over time to your body, and also for those who want to prevent themselves from having damage to their body and prevent themselves from chronic disease and chronic problems in general. So that will be what I will talk about to help to balance this understanding between the interventions that are presented to us, which I do believe are Band-Aids, and they are distractions from doing the work that it takes to reverse damage on your own. And I do understand that people need help in this area, but a lot of people are not informed and are not educated to be presented with other options that they could choose from. And if you have options that you can choose from, then you can make better choices concerning your health. So I want to help you with that, and I will do that next time. Now, I do want to say, please make sure that you subscribe to this podcast, and I will continue to serve you with information that can guide you to living the life that you desire to live as it pertains to your health. I want to hear more about what it is that you want me to talk about. You can put it in the comments and let me know, and I'll make sure that I talk about the things that are on your heart and the things that you even struggle with. So please do not hesitate to ask questions and put in suggestions so that I can make sure that we are upgrading our health walk and our health life as a community together, because that is what I am here to do. And it is my absolute joy to be able to present the evidence and the scientific proof and just my understanding of what it takes in the health world to make sure that you're living your highest quality life and to experience life on your terms by taking control of your health. I'm Kamilah Stevenson, and this has been an episode of Healthgoat. I'll see you next time.